Hi, I'm Tim Reed with Rosamond News, and we have Taylor here today. Taylor, what do you do here?
I'm a medical assistant for Rosamond Urgent Care.
Medical assistant, yeah. So Taylor, tell us why this is a big deal for the Rosamond community.
Yes. Well, it's definitely a lot closer than having to drive to Lancaster or Palmdale to go to the doctor for a common disease, like if you have a cough or a cold. We're definitely a lot closer, and you don't have to go drive way over there and wait in line for about an hour just for a cough. We can hopefully get you in and out in about half an hour.
Totally. Yeah, we're in the back right now. There's a lot of people, a lot of noise, trying to make sure you guys can hear us. So how many examination rooms do you guys have?
There are 5 exam rooms. There's one at the bariatric table, which goes all the way down, and then there's one specified OBGYN room.
What's that?
That's for the lady exams for gynecology or pap smears.
All right, cool. So there's a lot of question about the kind of insurance you guys are taking. So it's just Medicare right now.
Currently, right now, that's all we're contracted with, but we are working on getting a lot of other insurances.
Right.
They're just taking their time getting
So
back
yeah,
to
it's a
us.
whole process, huh?
Yeah. One of the main ones that we do want to get, though, is current family care.
Current family care?
Yes.
Yeah, so that's through the county, right?
Yes.
Yeah.
Like LA Care, but since we're current.
Yeah.
Yeah.
Totally. Okay, so what about insurances like maybe union workers, operating engineers, like electricians, that sort of thing? Is there any talk about that?
Not that I know of.
But
I know
maybe
we're
soon to
trying
come.
to do DOT certifications,
Mm.
and we're working on getting a possible DOT drug screen bathroom. But currently, if you need a DOT physical, we do have a nurse practitioner that's certified to do those. But the union and laborers, I'm not sure yet.
Okay, so you were telling us in the tour about ambulances, just for the folks at home. How's that going to work if someone needs to be moved to a hospital?
If necessary, we'll call Hall, since they're right the closest ones, and we'll get you transported over to the hospital. Hopefully it'll be Palmdale Regional, but AV is probably the closest if you would need immediate care.
So if you really need it right away,
Yes,
AV.
if you're having a heart attack or a stroke, they'll take you to the closest hospital.
Yeah, but if it's a broken bone, it can wait.
Yes.
It can wait and get you to Palmdale.
Yes.
All right, cool. So when do you guys open?
The 21st at 8 o'clock.
So that's Monday.
Yes.
So starting Monday, people can just drive down the street and come and get their medical care.
Yes.
Yeah, that's great. How many employees do you guys currently have?
We currently have 3 medical assistants and 2 nurse practitioners.
No doctors yet?
No, we're not going to hire any medical doctors.
Oh, okay.
Just nurse practitioners.
Oh, right. That's not a normal thing for just clinics, right?
Yeah.
Yeah.
Nurse practitioners and physician assistants are usually stick to urgent care, but there will be one supervising doctor. He just won't be on site.
Oh, okay.
Yeah.
All right, cool. So is there anything else you'd like the Rosamond community to know about this place, about maybe the hard work?
Well, a lot of hard work went into getting this together, 5 years in the making. We are still working on getting x-rays. Hopefully we'll get that up in the next 3 or 4 months, hopefully.
Oh, cool.
But we definitely hope that if you do have to come down here, you have a good experience and you don't have to wait forever to be seen. Get the care that you need.
All right, great. Thank you, Taylor. I appreciate it. So we've got the provider's office here. This is where they're going to go through your insurance, make sure that's all squared away. Consultant room, nice little office to consult you on maybe future treatments, things of that nature. And then we have our first exam room, or really the 5th exam room. This is one big circle, but this is the one that the young lady was talking about in the interview that goes up and down, as you can see, to accommodate people who are maybe in a wheelchair or handicapped. This is the medical workstation over here. I have a couple computers, saying normal doctor stuff. Scale, a nice little clinic. Continue going through. We got exam room 4, This is where you start to get sort of your basic examination room. You know, you got all your instruments and things you need, sterile gloves, all that good stuff. Walking through, we got one more exam room, exactly like the others. Supply closets. It's a nice little bathrooms back here. Place for staff to go, break room type thing. So walking through, we go on this other side. There's just one big circle. We have a storage room, store some stuff. Another storage room. Not much to say about this other than it's going to be much more full in the next week. Exam room 2. The first 3 were over there on the other side. Sort of the same deal. And last exam room. So it's a nice. It's going to be great for the Rosamond community to have a place they can call theirs, especially as they continue to get healthcare providers.